All right, looks like we got a full house. Let's get started here. I promise you guys 10 minutes or less, and we are going to make that happen. I know this is lunch hour for most of you, so thank you for taking the time. My name's Clay. I'm an NP. I'm board certified in general medicine. I'm also a member of the American Academy of Anti-Aging Medicine, aka Hormones and Peptides, and I love men's health. I've been doing this for almost 7 years. I started in primary care because we had guys coming into our clinic and nobody really knew what to do with them. So I just started studying and learning and asking questions, and that's turned into years of ongoing education and deepening my skill set into helping guys look and feel their best. It is fun to get guys feeling good. It is very rewarding. I enjoy it. You enjoy it. So it's a good place to be in medicine. As a reminder, this is a recorded webinar, so I've got your cameras turned off. The chat function is on though, so feel free to get in there, say hey to everybody, ask questions. I'm actually going to open up my chat as well too. The very first thing I see is from my buddy Jason. Bro, why are you wearing a tie? You're not that fancy. All right, Jason, here, I'll take off my tie for you. Only because you and I both know that this is the only time you can talk trash because your golf game definitely can't support it. Oh man, this is going to be good, guys. This is fun stuff. All right, enough of that. Men's health, what is it? So you've probably heard the term men's health, but may not know exactly what it means. Think of men's health like any other specialty: cardiology, pulmonology, primary care. It's a specific specialty within medicine that focuses exactly on what it sounds like: the unique anatomical, physical, and metabolic needs of the male gender. I like to break this up for patients into 3 broad categories: your physical health, the unique structures of the physical body of a man; sexual health, of course, unique anatomy, especially in the reproductive organs; and of course, hormone health. Hormone is always the big one. That is typically what most guys come into my clinic wanting help with, and that's what we're going to spend most of our time talking about today. Testosterone being the biggest hormone of them all, of course. We've all heard about testosterone. We have a pretty good idea of what it is and what it isn't. I like this visual a lot because it just clearly in one picture summarizes how a lot of guys, including myself, feel. In your 20s, you are feeling like Superman. You can roll out of bed and go play a football game. You can throw down a pizza and still have a six-pack. And then you get in your 30s, your 40s, your 50s, even your 60s, and not so much. If you took how you felt and put it as an overlay of this testosterone waterfall, you'll probably have a pretty similar slide downhill, just how you feel versus how your testosterone levels are correlating. Not saying that testosterone is related to everything that's a problem for you, but there's a lot of correlations that I see in guys, and when I get their hormones optimized, a lot of those things seem to kind of disappear. So this is a big one that we focus a lot on, and it really, really does make a difference. All right, so if you don't ever speak to me again and you don't get anything out of this webinar, this is what you should focus on if you're going to retain anything in your memory. Feel free to take a picture if you want. This is here for you to really absorb, digest, and actually use in your daily life. When I have guys who come in and they don't want to do anything exogenous or outside of their body, meaning, injections or anything like that, or supplements or pills, I tell them to do these 4 things and do it really well, and it does make a difference. It's not going to double your T levels. It's not going to be an overnight, 180-degree game changer. But if you do these things and we check your labs in, 2 or 3 months from now, I often see a 20-25% bump in testosterone levels without putting anything in your body other than these 4 key categories here. The big ones, by the way, that I see are the HIIT training. Guys' bodies love interval training. There's something about it that just tells the brain we're doing something really hard and we feel like we're going to die, and everybody needs to get on board inside, including testosterone. It just seems to work quite a bit. So if you're not doing high intensity interval training, get on YouTube, find a trainer, start incorporating this into your workouts, and you will notice a difference in how you look and feel, guaranteed. The next one, of course, is nutrition. That is something that is probably the biggest factor, if you ask me, to rank these, 1 through 4. What you put into your body has so much correlation with how you look and feel. No surprise, right? So what can you do to help yourself? Put good food in your body and do the right things. If you're sitting around all day, putting junk in your body, sitting on your butt all day, smashing a couple of beers at night, and then waking up and doing it again 7 days a week, you're not going to look lean and jacked and fit and feel your best, even if you're on a tee shot. It's hard work. You have to put in the work. I'll do my part. You do your part. That's what my ask is of my patients. So do these 4 things, whether or not you and I end up working together or talking about your health, and you will feel better, guaranteed. Peptides. These are becoming extremely popular, and for good reason, because they work. There is a lot of new research coming out showing that not only in men's health, peptides in general can be a game changer in so many different areas of medicine. They're looking at things like how to prevent Alzheimer's or reverse Alzheimer's with peptides. They're looking at how to actually treat different kinds of cancers with peptides. These are basically the building blocks of countless different functions that your body needs to do its job and do its job well and keep you healthy. So basically what peptides are giving your body the building blocks that it needs to do the functions it knows how to do. But over time, as we age, especially with testosterone decline, your body doesn't have enough or any of the building blocks it needs to grow muscle cells, let's say. So we give you peptides and you're basically spoon feeding your body the ability to drop weight, lose your gut, put on lean muscle mass, etc., etc. The other one is growth hormones. This one is a little bit more of a potent step up if guys want to add on after TRT because they want to get to the next level or they've plateaued. I usually start with peptides, and then if we need and want, we can go to growth hormones. These are more potent, but they do work really, really well. In short, this is basically directly telling your brain to produce more growth hormone, or in sometimes actually giving you synthetic growth hormone to really just give it everything it needs to get to the next level. So this is where guys talk about anabolic steroid abuse, things like that. This is true, but if it's monitored in the right way with blood work and doing it accordingly, guys typically do pretty well with these with very little side effects. I have guys on these for years. They're doing it the right way, doing the right things that I mentioned on the last slide, and they are feeling really great and looking great as well too. All right, that's it, guys. What did we do? Under 8 minutes. Perfect. So if you want to reach out, you want to learn more, here's my contact info. No pressure at all, but I definitely would love to talk to you if you have questions in general or want to take the next step in looking and feeling better. I'm really big on pricing. I put it right up here. No, red tape, no, bait and switches. Here's what you get for the price you pay. I know I want that as a patient, so I give that to my patients. It's really clear and easy. As I mentioned, peptides and hormones are an additional cost just because it costs me more money. But most guys, I say, let's start on TRT. You're probably going to feel and look fantastic. And then if you want to at some point in the future talk about the add-ons, we can do that. All right, we've got another minute and a half to get to 10 minutes. Let me look through the chat and see what questions you guys have. How much does it cost? What's the charge? What's your pricing structure? Yeah, of course, pricing is big. So guys, it's $269 of everything you mentioned here, or I put on the screen here. In the future, I probably will have to raise the price, just to be honest. Medications are getting more expensive, but this is really a smoking deal. I know there's guys in this webinar right now who are at some big clinics in the Phoenix area, and they're paying twice as much for half the results. I know that because I've seen their blood work. So this really is a great deal. Just know that I may have to raise prices in the future just a little bit, just because medications, like everything else, is getting more expensive. Do I have all the things in the men's health, or only what I want? Okay, sorry, I always touch on this. I just forgot. So the question was, do you have to have all these things or get all these things, or can you just get one thing if you only need one thing in the men's health arena? Short answer is yes. Some guys come to me just saying, I just want to impregnate, my significant other. I don't care about anything else. Just make sure that I can have a baby. So we focus on just fertility. Or, hey, I don't want to do anything else, but I just want to stop or prevent, further hair loss because I love, my hair up top or whatever it may be. So yes, we can focus on one thing. We can focus on all things. It really depends on what you want and what you need. We'll definitely customize to the things that you want and not mess with the things that you don't. Do I have the pill? Do I have a pill form and testosterone because I don't like needles? Yeah, definitely. So this is something we do a lot because a lot of guys actually say this. So personally, just so you know, I prefer injections. I think they work better. I think it's more convenient and it's much more studied. All the research, all the studies that you see is based on injections. So when you get into the more creams, or oral troches, which are the ones that go underneath your tongue, they're typically generally safe, but they're just not as well studied when it comes to dialing in the doses, the efficiency, how it interacts with other medications. So I always push guys towards the injections. And honestly, once a week injection, it's a really, really tiny needle. I actually make a special compound with the pharmacy that makes the oil that the testosterone is. It's really thin. So that means I can use a smaller needle for my patients, which means a less painful injection right into the belly fat. You feel a little pinch, typically no blood at all, and you're good to go. You do the oral things and things like that, you're talking about daily, sometimes multiple times a day. I just think it's easier to just do an injection. But to answer your question, yeah, we absolutely can do that as well too. Do I have to come into your clinic to get the medication, or how does that work? Great question. So I have patients all over Arizona. So I have some patients that I haven't seen in a long time physically and have never even been to the clinic, and that's totally fine. Our office is up in Scottsdale. Most guys just do telemedicine, text me, call me. I can actually send meds right to your doorstep, do blood work at LabCorp or whatever the closest lab is near your house. So really we can manage you completely remotely if you prefer that. But again, if you want to come in and hang out and chill, I'm always happy to hang out with you. Great questions. All right, so we're almost 12 minutes now, so I'm going to cut this off and be respectful to people's time. You have my contact information up on the screen, so please feel free to reach out. Honestly, that's my personal cell phone, so feel free to text me, call me, send me a voice memo, whatever you want. Happy to talk through your unique case and help you whether we work together or not. So appreciate the time, guys. Look forward to it, and be healthy.